Assalamu alaikum everyone. You are watching Pharmacist Briefs and I am Ikra Aurangzeb. We were discussing autonomic nervous system. In autonomic nervous system we have sympathetic nervous system and parasympathetic nervous system. And as you all know that sympathetic nervous system and parasympathetic nervous system both works in opposite direction. Well, the drugs that act on sympathetic receptors and initiate or activate their action are called sympathomimetics, as they mimic the action of sympathetic receptors. Whereas, contrary to this, the drugs that act on sympathetic receptors and inhibit their action are called sympatholytics. So, we are going to discuss the respective receptors and their actions through easy mnemonics. Well, in the previous lectures, we have already discussed alpha 1 receptors. Just have an overview of the previous lecture. So, in the previous lectures, I told you the mnemonic for alpha 1 receptors that was Blamov kid's gut. Now, what is Blamov? It is B for bladder, means inside bladder, alpha 1 receptors are responsible for the closure of sphincter muscles of bladder. So, whenever the closure of sphincter muscles of bladder, whenever the sphincter muscles of bladder are closed, the detrusor muscles will be relaxed, which will result in the urinary retention. So, alpha 1 receptors are responsible for the retention of urine. Well, next is L. L for liver. Now, what happens inside liver due to alpha 1 receptors? Inside liver, alpha 1 receptors are responsible for gluconeogenesis and glycogenolysis. Now, a molecule of glucose is a formation of new molecule of glucose takes place, whereas glycogen is broken down. Okay, now next is A for arterioles. Inside arterioles, vasoconstriction is increased. That will result in increase in peripheral resistance. Next, M, male sex organs. Well, inside male sex organs, always remember alpha 1 receptors are present that will cause ejaculation. Now, eyes, E for eyes. Inside eyes, alpha 1 receptors cause mydriasis. Now, what is mydriasis? Mydriasis means increase in the size of pupil. You can simply call it dilatation of pupils. Well, next we have V for veins. Inside veins, what will happen? It will cause contraction of veins. Now, alpha 1 receptors will always cause contraction of arterioles, contraction of veins. Next, glamour. Bladder, liver, A for arterioles, M for male sex organs, E for eyes, and P for vessels. So next is kids. Kids is for kidneys. Inside kidneys, alpha 1 receptors will decrease the release of renin. Okay. Next, gut. Gut is for GIT. Now, alpha 1 receptors control the contraction of smooth muscles of gut. So, the mnemonic is alpha glamour kids gut. Okay. Just remember the mnemonic. From mnemonic, you will memorize the actions. Receptor locations, and from locations, just memorize the actions. Now, alpha 2 receptors. For alpha 2 receptors, just always remember that alpha 2 receptors are involved in feedback inhibition. They decrease the release of neurotransmitters by feedback inhibition. Okay. Inside pancreas, they decrease the release of insulin. Inside CNS, they decrease the sympathetic outflow. From CNS, alpha 2 receptors will decrease the sympathetic outflow of neurotransmitters. Next, in pancreas, insulin is released. that will also be inhibited due to alpha 2 receptors. And at presynaptic adrenergic nerve terminals, they inhibit the release of neurotransmitters. And the neurotransmitter for sympathetic nervous system is adrenaline. Well, let's move on to next receptors, beta receptors. So in beta receptors, we have beta 1 receptors, beta 2 receptors, and we also have beta 3 receptors. From now on, let's discuss beta 1 receptors and beta 2 receptors. So for beta 1 receptors, the mnemonic we have is just this pant hurt my eyes do. Okay. So how come? In kidneys we have, what is the structural and functional unit of kidneys? Nephrons. So inside kidneys we have juxtamedullary apparatus. What happens inside kidneys, juxtamedullary apparatus, the release of renin is increased. Like beta 1 receptors are involved in the increased release of renin. Do not forget that alpha 1 receptors were involved in decreasing the release of renin, whereas beta 1 receptors will stimulate the release of renin. Okay. Inside kidneys at juxtamedullary apparatus. Juxtaglomerular apparatus. Now, what is PANT? PANT is presynaptic adrenergic nerve terminals. So what happens at presynaptic adrenergic nerve terminals? The release of neurotransmitter, that is adrenaline, is increased. Next we have the main organ, heart. What happens at heart? Now just listen and understand it carefully. Inside heart, beta 1 receptors have three actions. What happens at SA node? What happens? Heart rate is increased. When heart rate is increased, as you all know, that increase in heart rate is termed as tachycardia. Now, increase in heart rate is chronotropic effect. So, when heart rate is increased, it means at SA node, beta 1 receptors are involved for positive chronotropic effect. What happens at AV node? At AV node, beta 1 receptors are involved in the increase in conduction velocity. Increase in conduction velocity is termed as positive dromotropic effect. Third one, at atrial and ventricular muscles. At atrial and ventricular muscles. And what happens at atrial and ventricular muscles? Contractility is increased. So, beta 1 receptors increase in contractility is termed as chronotropic effect. So, beta 1 receptors are involved in increasing the heart rate, conduction velocity, and contractility of heart. Ultimately, the force of contraction of heart is increased. So, one more thing. When the force of contraction is increased, the consumption of carbon dioxide and oxygen will also be increased. Of course, the activity of heart is increased. It will increase the requirement of oxygen. Okay, now next. So, for these actions at SA node, at AV node, and at atrial and ventricular muscles, remember this sentence. When beta 1 saw his crush, ICs means in chronotropic effect, DC is dromotropic, and IC is inotropic, DC is dromotropic, and C for chronotropic effect. So, when beta 1 saw his crush, ICs, DCs, and Chaudhurys of his heart started running. Okay. Let's move on to next, beta 2 receptors. What happens at beta 2 receptors? Beta 2 receptors are involved in relaxation. Okay, beta 1 receptors will increase the activity of heart, increase the activity in release of renin and all that. And what beta 1 receptors are, relaxed muscles. What will happen inside pancreas? They will increase the release of insulin. Okay, at adipose tissue, they will increase lipolysis. So, at bronchial smooth muscles, they will cause bronchodilation. Beta 2 receptors will dilate the bronchial smooth muscles. Uh, okay, inside bladder, they will cause relaxation. Inside liver, they will increase the glycogenolysis. And inside skeletal muscles, glycogenolysis. Inside skeletal muscles and inside liver, at both sides, the glycogenolysis will be increased. Well, now let's learn it with mnemonics. PAN. PAN is for pancreas. As I have already told you, inside pancreas, the release of insulin will be increased. Versus VS. VS is for vascular smooth muscles. And at vascular smooth muscles, beta 2 receptors will cause vasodilation. Vasodilation, what happens because of vasodilation? It will cause decrease in the total peripheral resistance. As a result of decrease in total peripheral resistance, the diastolic blood pressure will be increased, and ultimately the afterload will be decreased. So, now bubbles. What is bubbles? Bubbles is bladder wall smooth muscles. Again, relaxation at inside bladder, and inside B for bladder, U for uterus. Inside uterus, it will again cause the relaxation because of vasodilation. Well, next bulge is for bronchial smooth muscle, BLES, bronchial smooth muscles. Now, what will happen at bronchial smooth muscles? It will again cause bronchodilation. So it was pan versus bubbles.